Did you know that what you do in the hour before you hit the sack could make or break your blood sugar levels overnight? Most guys get this wrong, and honestly, it's quietly wrecking their health without them even realizing it. I've been practicing medicine for over 15 years now, and I can tell you firsthand, managing diabetes isn't just about what you eat during the day or how many steps you get in. What happens while you're sleeping, and what you do right before you close your eyes, that can have a massive impact on your blood sugar. If you're waking up with numbers that are way too high or dangerously low, chances are your nighttime routine needs some work. I'm Dr. Isabella Norris, and today I'm going to walk you through 5 powerful nighttime habits that every man dealing with diabetes should know. These are simple, practical changes that can keep your blood sugar steady and your mornings stress-free. And gentlemen, I promise you, these aren't just a bunch of restrictions and don'ts. I'm going to tell you exactly what to do, step by step, so you can take control tonight. Let's get into it. All right, habit number 1, and this is a big one. Pick the right nighttime snack. Now, I know a lot of you guys get hungry before bed. That's completely normal. But here's the thing. What you reach for matters a whole lot more than you might think. Choosing the right snack isn't just about killing the hunger. It's about setting your body up for stable blood sugar all night long. And for a man living with diabetes, this can be an absolute game changer. See, while you're sleeping, your body is still working. It's processing glucose, maintaining balance, keeping everything running. A well-chosen snack can smooth out that whole process, minimizing those spikes or sudden drops in blood sugar that mess up your sleep and leave you feeling lousy the next morning. So what should you go for? Focus on snacks that are low in carbs but packed with protein, fiber, or healthy fats. These nutrients play a critical role in stabilizing your glucose levels. Protein slows down digestion, so sugar gets released into your bloodstream nice and gradually. Fiber adds bulk and keeps you feeling full longer. And healthy fats slow down glucose absorption, preventing those rapid spikes. Let me give you some real examples, stuff you can actually find in your kitchen right now. A small handful of almonds or walnuts, that's a perfect combo of protein, fiber, and healthy fats. They work together to keep your blood sugar steady and your hunger in check. A serving of plain Greek yogurt with no added sugar is another great option. It gives you solid protein to sustain you through the night, and you can toss in a few berries for extra fiber. If you want something crunchy, try some carrot sticks with a little bit of hummus. Low carb, filling, satisfying. Or grab a hard-boiled egg, maybe a slice of whole grain toast with some avocado. Simple, easy, and it does the job. Now, on the flip side, you want to stay away from snacks loaded with refined carbs or sugar. I'm talking about cookies, white bread, chips, that kind of stuff. They might seem like a quick fix, but they'll spike your blood sugar fast and then send it crashing down. You could wake up with unstable levels or feeling completely drained. And here's a tip about timing. Try to eat your snack about 1 to 2 hours before bed. That gives your body enough time to digest and absorb the nutrients without overloading your system right before sleep. And remember, portion control is key here. Even healthy snacks can cause problems if you eat too much. Keep it moderate. Keep it smart. All right, habit number 2, set a consistent sleep schedule. Now I get it. A lot of you guys have been staying up late watching the game or catching up on the news and then sleeping in on weekends to make up for it. But let me tell you, from everything I've seen in my 15 plus years of practice, an irregular sleep pattern is one of the most underestimated enemies of good blood sugar control. Your body thrives on routine. Going to bed and waking up at the same time every single day, yes, including weekends and holidays, can have a tremendous impact on how well you manage your diabetes. Here's why. Sleep regularity helps regulate critical hormones like insulin and cortisol. When you sleep consistently, your body's insulin sensitivity improves, meaning it can use blood sugar more effectively. But when your sleep is all over the place, that balance gets disrupted. Sleep deprivation drives up cortisol levels, that stress hormone that triggers blood sugar spikes. It also messes with the hormones that control your appetite, leading to cravings for unhealthy, carb-heavy snacks that make blood sugar control even harder. Research has even shown that poor sleep quality can lead to insulin resistance, which is a significant challenge for anyone dealing with diabetes. So what should you do? Aim for 7 to 9 hours of sleep every night. Set an alarm not just to wake up, but to remind yourself when it's time to start winding down. Create a relaxing pre-bed routine. Read a book, do some light stretching, maybe try a few minutes of meditation. These subtle signals tell your body it's time to relax. And here's something a lot of guys overlook. Your bedroom environment matters. Keep it dark, quiet, and cool. Invest in a comfortable mattress and decent pillows. The benefits of deep sleep go way beyond blood sugar control. During deep sleep, your body releases growth hormones that help regulate fat metabolism and stabilize glucose levels. Better sleep also improves your energy, your mood, and your ability to stick with other healthy habits like regular exercise and mindful eating. Think of it this way, a solid sleep schedule is the foundation everything else is built on. Get this right, and the other habits become a whole lot easier. Now, habit number 3, limit your screen time before bed. I know, this one's tough. Most of us are glued to our phones, tablets, or TVs at night, checking sports scores, scrolling through the news, watching a show before bed. But here's what a lot of people don't realize. The blue light coming from those devices seriously interferes with your sleep quality. Blue light suppresses the production of melatonin, the hormone that helps you fall asleep and stay asleep. When your melatonin levels drop, your body has a harder time recognizing when it's time to wind down. That makes it really difficult to get that deep, restorative sleep you need. And for men with diabetes, this is particularly problematic. Poor sleep disrupts blood sugar regulation. Without adequate rest, your insulin sensitivity decreases, and you're more likely to experience blood sugar spikes during the night and into the next day. So here's what I recommend. Try to shut off all screens at least 30 minutes before bed. I know that might sound like a lot, but give your body a chance to start producing melatonin naturally. If you're used to checking your phone or watching TV until you fall asleep, it might be a challenge at first, but the benefits are absolutely worth it. Instead of relying on your devices, swap that screen time with something relaxing. Read a physical book, do some gentle stretching, try a breathing exercise. These activities help ease you into a restful state without the blue light interference. And there's another benefit to cutting back on screen time at night. It helps reduce stress. Constant exposure to social media, work emails, or the 24-hour news cycle can keep your mind racing, and that's the last thing you want when you're trying to sleep. By stepping away from your devices, you let your mind slow down and focus on more calming thoughts. Now, if you absolutely can't cut screens completely, at least use the night mode settings on your devices to reduce blue light exposure. Some guys find blue light blocking glasses helpful too. But honestly, nothing beats just disconnecting completely as part of your bedtime routine. This simple change can have a profound impact on both your sleep and your blood sugar control. Habit number 4, manage your water intake wisely. Staying hydrated is incredibly important for diabetes management, no question about it. Water helps transport nutrients and flush out excess sugar from your bloodstream. If you're dehydrated, your blood sugar levels can climb, and that leads to discomfort and potential complications. But here's the catch, and this is where a lot of guys mess up. Drinking too much water right before bed can actually backfire. It causes those middle-of-the-night bathroom trips that fragment your sleep. And as we just talked about, broken sleep hurts your blood sugar regulation, creating a vicious cycle of interrupted rest and glucose spikes. So the key is balance. Try to drink most of your water earlier in the day. Aim for about 8 glasses total, depending on your individual needs, your activity level, the weather, all that stuff. Then gradually reduce your fluid intake in the evening and try to stop drinking about 1 to 2 hours before bedtime. If you do find yourself thirsty close to bed, take small sips instead of chugging a whole glass. This way, you stay hydrated without setting yourself up for a disrupted night. And let me tell you something a lot of my patients don't think about. Proper hydration throughout the day actually supports better kidney function, digestion, and circulation, all of which matter for diabetes management. It's not just about how much you drink. It's about when you drink it. Get this balance right and you'll sleep better, your blood sugar will be more stable overnight, and you'll wake up feeling a lot more rested. And now we come to habit number 5, and honestly, this might be the most important one of all. Check your blood sugar before bed. Monitoring your blood sugar levels before you go to sleep is one of the single most impactful things you can do for overnight glucose stability. Checking your levels doesn't just give you a snapshot of how your body responded to the food, exercise, and medication from that day. It gives you the power to make adjustments before you go to sleep. And that small step can make a huge difference in how your body functions overnight. When your blood sugar is too high before bed, you're at risk for hyperglycemia during the night. Elevated levels can cause frequent urination, disrupt your sleep, and make it hard to rest and recharge. On the other hand, if your blood sugar is too low, you could experience symptoms like shakiness, dizziness, or even hypoglycemia, which can be dangerous if you're asleep and not aware of what's happening. That's exactly why checking before bed is so critical. When you know your numbers, you can make informed decisions. If your blood sugar is higher than you'd like, you can adjust your bedtime snack or your insulin dose accordingly. If you find your levels are running low, you can eat a small, healthy snack to prevent a dangerous drop during the night. Use a reliable glucometer and try to check at the same time every evening so you build a consistent routine. Aim for the target range recommended by your doctor. And here's a pro tip from someone who's been doing this a long time. Keep a log of your readings. Over time, you'll start to notice patterns. Maybe your blood sugar tends to spike on days when you skip your evening walk. Maybe it drops on nights when you didn't eat enough at dinner. These patterns are incredibly valuable information that helps you and your healthcare team fine-tune your diabetes management plan. If you're not sure what your target range should be, or if you need help making adjustments, always consult with your doctor or a diabetes specialist. This isn't something you want to guess on. Now, before I wrap up, I want to address something that's really important to me. I've heard from some of you, and I've read your comments, that sometimes health advice can feel like nothing but a long list of things you can't do. Don't eat this, don't drink that, stop doing this. I understand that frustration, I truly do. And that's exactly why I wanted to structure today's video differently. Every single habit I shared with you tonight is something you can do, something positive, something actionable. Pick the right snack, set a consistent schedule, swap screens for something relaxing, manage your water intake smartly, check your numbers. These aren't restrictions, these are tools. They put you in the driver's seat. You're not just reacting to diabetes, you're getting ahead of it. And also, one thing I want to be clear about because I think it's important, these habits help you control and manage your diabetes. They can make a real, measurable difference in your quality of life. But I want to be honest with you because you deserve honesty. This isn't a cure. Anyone who tells you there's a simple trick that cures diabetes overnight isn't being straight with you. What I'm offering you is something better than a miracle promise. I'm giving you proven, practical habits that actually work night after night to keep your blood sugar stable and your health on track. And for those of you who asked about some of the terms I use, like what counts as a nighttime snack versus dinner, let me keep it simple. Dinner is your main evening meal, the one you sit down for, usually a few hours before bed. A nighttime snack is something small you eat closer to bedtime, maybe an hour or two before you hit the pillow. Think of dinner as the main event and the snack as the closer. Keep that snack light, protein-rich, and low in carbs, and you're golden. Also, I want to give a quick shout out to those of you who shared your own tips in the comments. One of you mentioned eating cucumbers with a little lemon and salt as a nighttime snack, and honestly, that's a great option. Low carb, hydrating, and satisfying. Keep sharing what works for you because we all learn from each other. So let me do a quick recap. 5 habits, 5 things you can start doing tonight. 1. Choose a smart bedtime snack with protein, fiber, or healthy fats. 2. Go to bed and wake up at the same time every day. 3. Put down the phone and turn off the TV at least 30 minutes before bed. 4. Drink your water earlier in the day and taper off in the evening. 5. Check your blood sugar before bed so you know exactly where you stand. These 5 habits, they're not complicated. They don't cost money. They don't require special equipment. But together, they can transform how your body handles blood sugar overnight. You'll sleep better, wake up with more stable numbers, and feel more in control of your health than you have in a long time. I've seen it happen with my patients over and over again in the past 15 years, and I want the same results for every one of you watching right now. If this video was helpful, please hit that like button. It really does make a difference and helps us reach more people who need this information. And if you haven't already, subscribe to the channel and turn on notifications so you never miss our latest tips. on managing diabetes and living a healthier life. Drop a comment below and tell me, which of these 5 habits are you going to start with tonight? I'd love to hear from you, and if you have questions, ask them in the comments. I read every single one. Take care of yourselves, gentlemen. I'll see you in the next video.